Well, certainly I want to look at ways, particularly of a market-based solution, to make health care more accessible and more affordable for Americans. If you look back to where we've been in terms of where Obamacare came on the scene, it increased the insurance cost, both in terms of premiums and in terms of the amounts billed. And if you talk to people, they'll tell you they think they have less access to better health care now than they did before that. And so the way it's been set up has just been wrong from the jump. And so I hope that there's the courage and the foresight here, frankly, in both parties, to try to come up with something that works better, that's more of a market-based approach, that gets rid of these taxes that are involved, gets rid of all this extra money that's wasted, the money, frankly, that's spent on the bureaucracy. Put that in actually giving health care outcomes for folks.
Well, I hope it goes as normal, in regular order. As we've said, all 7 weeks so far. Just open up the government and we'll negotiate on anything. That includes health care and the subsidies to try to prop up Obamacare, which is a failed program anyway. But we'll talk about it. But that gives us also the opportunity to offer solutions that would work better for the people.
And so it's also important for people to understand that when you're talking about what's out there is that we're not talking about they're getting rid of Obamacare or the Affordable Care Act, in which we're finding out since 2010 it hasn't not been affordable at all. And that's what all the American people were told when this thing was passed. And I had voted against it back in 2010. But what we saw happen was the Democrats during COVID, it was their excuse. They came up with saying, well, we're going to have to put these subsidies in. Not one Republican ever voted for Obamacare. Not one Republican voted for any of these massive $10 trillion spending bills that the Democrats had. The Democrats had their opportunity, but it was so high in cost. That's why they made it 5 years, and so make their numbers look where they are. So I think what you're going to see is that that over in the Senate, they're going to have the opportunity to have a bill up that later, I think it's in December, is what Senator Thune said, and they'll proceed from there.